does some of this need to fall on the parents, the coaches, or is just everyone needs to kind of, come together to make sure that we're taking care of our kids and athletes?
Ideally, I
Maybe
think
Dr.
it's an everybody approach, but I think especially in the throwers that I see, it's kids who are playing for multiple teams, so you can't ask the coaches to
Mm,
necessarily be entirely responsible because if they're playing for two and three different teams and they're
that's a
working
good
with a
point.
pitching coach, nobody's talking to each other for the most part, so nobody's keeping track of how many pitches you threw Tuesday night for your middle school when you're playing Thursday night for your travel team, and then you got 3 games on the weekend or working with your coach in between. So
Yeah.
ultimately, I think the parents are the ones who are going to hold a lot of that responsibility, but they're also the ones who are probably feeling the most pressure to keep up with the neighbor down the street who's doing the same thing and the kid who's beating him out for
100%.
the spot on the team. And so it just gets caught in this really vicious cycle of trying to keep up with everyone else who they are perceiving to do all of the things that they want their kids to do, but that kid's not getting injured, so why is my kid getting injured? And um, it's a tough conversation that takes often a couple of visits to kind of get the parents on board with you to understand that a lot of this is not related to a specific moment in time or a specific injury, but it's all of the things that you're doing cumulatively that are where you are now.
Do, do you guys, maybe Dr. Starman, do you guys find that obviously, I mean, I brought this up probably multiple times in the last year on these podcasts regarding baseball, but I know there's other sports.